Which of the following is the most common cause of this patient's condition? A 35-year-old woman presents with a 3-month history of weight loss, increased appetite, heat intolerance, and palpitations. A physical examination reveals tachycardia, fine tremors, and enlarged thyroid gland. Lab tests reveal a decreased TCH and elevated T4. Which of the following is the most common cause of this patient's condition? Okay. Um, so it's pretty clearly, in my opinion, it is hyperthyroidism. So we have symptoms of that. And now this really wasn't given much besides like fine tremors, enlarged thyroid gland. Okay, so I would now lean just because it's an enlarged thyroid gland. They don't say like this part is enlarged or this is small, like in one portion. I would lean towards Graves' disease.
Okay.
Thyroid adenoma would, to me, they would say something like this one part is here. I could be wrong about this though. Subacute thyroiditis to me is I think that subacute de Quervain's thyroiditis, that's going to be painful, so that's not the answer. Pituitary adenoma is not going to see you with an enlarged thyroid. I don't think thyroid adenoma would be the right answer. And then toxic multinodular goiter. No, no, no. Multinodular. It would be multiple nodules. So I would. It could be thyroid adenoma, but I would go with this.
Yeah, beautiful. You worked through that, right? Healthy amount of skepticism there, right? But good. It's diffusely enlarged, meaning it's symmetrically enlarged, right? If it's toxic multinodular goiter, yeah, the whole thyroid can be enlarged, but usually it's lumpy, bumpy. So you should be able to describe it in physical exam, saying multiple nodules were felt on a large thyroid gland. Thyroid adenoma. Sometimes you can't even feel the nodule, so it could be a normal looking thyroid gland
Oh,
or
cool.
or feeling thyroid gland, I would say. But if the adenoma is big enough, maybe you feel one portion that is larger, like you said. Subacute thyroiditis, right? It's going to be a tender thyroid gland, usually at some kind of inciting event, meaning that maybe they have an upper respiratory infection that you're fighting off, and your body accidentally also attacks your thyroid, but you don't have really a history of that. And then a pituitary adenoma, right? Most of the time for step one, even for step two, they're going to give you symptoms, hemianopsia,
Yeah,
right?
bitemporal hemianopsia.
Exactly, bitemporal, right? And so no vision issues, right? They don't mention any of that, right? And so best answer here is definitely Graves. So you worked through that great.